Good evening, everyone, and welcome to Health Chats Among Friends. My name is Deidre Kendrick. I am a nurse advocate, educator, and navigator, and I get the pleasure of talking tonight with my friend Amy Holcomb, who's an RN also. Say hi, Amy.
Hi, Deidre. How are you tonight?
I'm great. I'm great. Well, Amy, tell us a little bit about yourself, and we'll go into our topic of discussion tonight.
Okay, thanks. My name is Amy Holcomb, like Deidre said, and I am a registered nurse and have been now for 33 years. So a lot of different backgrounds behind where I've worked in different areas of the hospital and also outside of the hospital. So I think that with that experience built up, it will lead into our discussion really well.
Absolutely. So, do you mind saying how long you've been a nurse?
33 years.
So, you just graduated the other day, right?
I did. I've only got a few months behind me.
That's right. Me too. Me too. Me too. Well, tonight we're going to be discussing the home health nurse perspective. And Amy and I have the privilege and the honor of doing a specialty home health type of nursing. So tonight we're just going to have a little chit chat back and forth about our love for what we do and the people we care for.
Absolutely. And I am so excited to talk about home health. It has been the most fun I've had in my 33 years of nursing. And I've had the privilege of working for what I call regular home health versus specialty home health. So I'm very excited to talk about that with you, Deidre.
Right, right. When I first left the hospital to kind of venture off into home health nursing, it was a different world.
It is.
It's
Yes,
a different
it is
world.
completely different than the hospital. In the
Yes.
hospital, it's a controlled chaos for the most part.
I like that.
You've constantly got somebody to back you up. You've got another nurse down the hall. You've got a nurse on another floor. You can always get help.
Right.
In the home care world, we're essentially Han Solo. We're an island unto ourselves a lot of times in the client's home. And we are having to work in sometimes really great conditions and not so great conditions.
Right.
We have to think constantly outside the box because we only have our two hands. We don't have anybody coming for backup and support at the push of a call light.
Right. And that brings me into the topic of I've had a lot of, I call them baby nurses. When you just first graduate from college and you're all excited and you want to go into home health.
Yes. And baby nurses really need to get a little bit of experience under their belt before entering the home health world. And part of that is due to the autonomy that you have to have in home health. You've got to know your systems really well. You've got to know what is normal versus what is abnormal. And what you're going to do with that.
Right.
Because you're alone. The family's looking to you for your professionalism and for your experience. And if you don't have that to draw upon, it really can influence the care that client is receiving in the home.
Right. And also there's no backup. You're by yourself. You're by yourself. And so
yes, we are.
Let me call the doctor and ask a question. 9 times out of 10, the home health nurse is going to be the last person the doctor is going to call because, they expect, they're working with the people who are in the hospital. That's their top priority. So
yes, it is.
You may get a call tomorrow
about that blood pressure that's really high or heart rate that's really high.
Right.
You really truly need to know where that line is and your comfort level and the disease process that's going on with the client to know, again, not only your comfort level, but what is that client's level? Where their max compensation for what's going on. when do we need to say when, and, you know, potentially have the client go to the hospital, which we always try not to do.
Right.
But sometimes extenuating circumstances do come into play, such as not hearing back from the physicians. We have to make that call.
Yeah. Critical thinking.
Yes.
Critical thinking. Mm-hmm. Because the environment in a home is not the hospital. Like you said before, it's a controlled chaos. So everything has a place in the hospital.
Yes.
There are systems in the hospital. And in home health, there are no systems. Unless there's procedures, you know, certain procedures that we do, which brings me to my next topic is we get the pleasure of doing IVIG infusions. So Amy, oh, I love it too. I love it. I love it. I love it. So lots of times when I tell nurses that my clients are immunocompromised,
yes,
and they have disease processes, that we have to be diligently careful when we're caring for these clients, especially in our new season. So sometimes we're in the home, 4, 5, 12 hours.
Yes, ma'am. Breakfast, lunch, and dinner.
Yes, ma'am. And it's that one-on-one personalized care. So you had mentioned something the other day, and I wanted to fill the callers in, that someone had said to you, how long are you in the homes? And they were just flabbergasted by that. So let's discuss that a little bit.
Yes, I was visiting with one of the local pharmacies that help fulfill IV infusion needs. And the pharmacist asked me, you know, what do you do in the home on an 8, 10, 12-hour infusion? And the answer is actually very simple. We have the privilege, like you said, of really getting to know our clients, getting to know what their medical history is, getting to understand the family dynamics, the cultural dynamics, the pets in the home, and the kids, and the schedule, and the doctor appointment schedules alone sometimes for our immunocompromised clients can be multiple during the week. And so we become really not only the advocate, but also part of their family.
Yes.
And that is the part that I absolutely love. You've got to have the clinical, you've got to have the theory, you've got to have, you know, the IV skills or the port access skills or the PICC line skills to be able to do the infusions. But then we get to treat not only the medical side, but the human side and the spiritual side when that comes up as well. And that is one of my favorite things of all.
Oh my goodness. Yes, because we did not get to do that in the hospital.
Very, very rare do we get to go out the medical disease process.
Right. And that's what I love about the job that we do, is getting to know the whole person, like you said, spiritual, mental, there's a family dynamics, because that all affects their overall health and well-being.
Absolutely. Yes. And it affects how they can manage their disease process.
Right.
You know, do they have to put half of their things on the back burner, take care of children, or, you know, trying to take care of the family? Do they have another person in the home that's even ill or dealing with the disease process? And that puts another layer into how that client that you're taking care of can take care of themselves.
Right. And the other point that I like to make is that I've had other nurses say, well, how can you stay in the home that long? And I'm like, I love it, because, you know, it's more of a in-depth getting to know that person.
Yes.
You know their likes, you know their dislikes, you know how they react to certain medications, you know their overall outlook on their disease process.
Yes.
Isn't that something, to be able to be involved in that journey? That's just amazing to me.
Oh, it is such a privilege to do the long infusions, because we do get that opportunity. And the clients are so thankful, number one, that they're not having to be at an infusion center or being admitted to the hospital for that time period. Because sometimes, you know, on the long infusions, if they had to be in the hospital, it was an overnight stay into the next day. And we are able to keep the client in the comfort of their own home. If they want to sit in the recliner and prop up their feet, they can. If they want to go lay down in bed for a while, they can.
Mm-hmm.
I've got some clients that like to watch, you know, HGTV, and we watch HGTV.
Yeah.
You know, if I've got a client that's a crafter, or which is actually one of my loves, I've got a quilter that I used to take a block with and quilt with them.
Right.
The adult coloring books that I've had clients that absolutely love doing that. You find that connection.
Yes.
And you're able to build upon just that one little snippet helps you get that much closer to the client.
That is so wonderful to me. You know, not to badmouth any other medical or Medicare paid home health companies, but I always felt like on the nursing side, now I can't say this, I felt like I was in and out. I didn't have time to really, because I had maybe 8 people that I got to see over the Metroplex, and I'm in the car knowing this one really needs to be educated on a certain medication, but I don't have the time. I had to hurry up and go because I got to change this wound dressing. Or I got to do this wound dressing, now I got to go over here across town to do this admission, and don't really have the time. But with our services that we provide with the IVIG Infusions, oh, let me back up. Tell people what IVIG Infusions stand for.
Oh, thanks. You're giving me the long words, are you? It is immunoglobulin infusions. And what that boils down to is the part of the blood that actually is responsible for the immune system. And there are also certifications that go along with that. And I do have my IGCN certification. And there are also regular infusion nurse certifications for our other types of infusions besides IVIG.
Right.
So, you know, it is a recognized specialty for infusion nursing. And there's more credit being given to home infusions now than what there used to be as well.
I think it's an amazingly wonderful service, being that, you know, you get to stay in the comfort of your own home.
Absolutely.
You don't have to go to a strange place. And a lot of our clients are working. They still work. So that's even harder. And a lot of our clients live in rural areas. So to have to go to an infusion center when you're not feeling well and you have to interact with other people, nothing against these infusion centers, but I want people to know you have choices.
Absolutely. There are choices. And there are choices for the once a month infusion, 2 weeks, the every 3 weeks, weekly infusions. We have several clients that we take care of that have genetic disorders, that have enzyme disorders, that we're replacing enzymes. And especially those two are in children that we do. And so the child is having to miss school. The parents are having to miss work to even take them for their, in these 2 cases, weekly appointments. One 5-hour infusion and one's, you know, an hour to 2-hour infusion, but that will still take up an entire day every single week.
Right.
And children get behind in school. Parents' jobs are like, you've got to be off every week, you know, and that. So when we can schedule after the child gets home from school, you know, what a difference that is for the child, number one, and school, and then the parents as well, that we can come when it's more convenient for them. And a lot of times it's so much easier for them to take maybe an hour or 30 minutes off of work early that day, take a later lunch,
Right.
and we can infuse after school.
Right.
So that truly is a great alternative if someone is on a medication that can be transitioned home.
Right. That's awesome too. And I think about the season we're in now.
Yes.
You know, especially with our clients, they can't even get a cold.
No.
And
we are having to be extra diligent
right.
ourselves. And, you know, we have to make sure that we are doing our flu vaccinations, which everyone should be doing right now.
Yeah.
We're making sure that, you know, we are wearing our masks, we are wearing our gloves, we are making sure that we are hand washing. We're encouraging our clients to wash their hands. You know, walking in on the kiddos, I have my hand sanitizer on my badge, and I put a little in my hand and a little in their hand, and
Yeah.
time to wash our hands.
Yeah.
And you know, even doing that little bit of teaching and education at whatever level they are, 4 or 8 in the case that I've been describing,
Mm-hmm.
you know, they're learning, they're getting those foundations.
Right.
They can help others. Oh, did you wash your hands?
Yes.
And they do check, you know.
Yes.
You know, I get asked all the time, Miss Amy, did you wash your hands? And I'm like, yes, I washed my hands.
You know, it's just such a joy to be a nurse, first of all. And nursing has such a wealth of different opportunities. So I always advise people to, you know, investigate their nurses that are coming into their home.
Absolutely.
Meaning that look up their license, ask them about their training, ask them, you know, their specialty, because a nurse is not a nurse is not a nurse. You can't call me and ask me about birthing no babies.
That is one area I chose not to go to.
I would be like, I know in the movies they say boil hot water, so maybe we should boil some hot water.
That's it. Boil hot water and get clean sheets and gloves.
Right.
Yeah, that's extent of labor and delivery.
That's my extent. That's all you're gonna get.
Yes.
Well, this has been such a fun evening. So, Miss Amy, if someone wanted to reach out to you to find out more about the specialty nursing that you do, how would they do that?
Yes, thank you. The number best to reach me is 214-800-5566. And just ask for Amy when that line is opened, and they'll direct you to me. I'm the director of nursing, and you will find me.
And she is an amazing director of nursing.
I paid her to say that, by the way.
Well, thank you, everyone. This has been so much fun. My name is Deidre Kindred. I'm a nurse advocate, educator, and navigator. I love providing you with resources from the healthcare arena. Thank you again, Amy, for your time tonight.
Thank you, Deidre, so much for letting me join you.
Oh, awesome. Anytime, anytime. Thank you again.
Thank you.